10 projects that are going on at the moment, and these are all master's student projects. I'll whiz through them because I know we're short of time, so I'm going to try and do 10 projects in 5 minutes. So just to give you a bit of background, we have a lot of students, I think 80 plus probably, full and part-time students, and they come from all over the world to study with us, and these are post-registration master's students. So they've already got their degree in physiotherapy, and then they come to learn some other stuff with us. So I want to go through a variety of different projects just to demonstrate the kind of scope of projects going on within the cardiorespiratory programme. So the first project is on patient mobility in intensive care in Oman, and that gives you an idea of the international flavour of some of our projects. The thing about mobility in intensive care is physios take it very seriously. Meanwhile, nurses have 1,000 other things to do as well as mobility. And some physios feel that mobility practice can be lost within the general needs to look after patients. So this student is going to look at some data and see how many patients or how often a patient's mobilised on the ward by either nurses or physiotherapists or other staff, collect some survey data, and also interview both nurses and physios about their perceptions of the importance of mobilising in the intensive care unit. Staying in intensive care, some people have kidney transplants, and those that do often have a Vascath, so a venous catheter. The problem is that these sometimes pull a bit when people are walking on the ward. And so student 2 wants to find out a little bit more about whether securing a Vascath will reduce the amount of painkillers that patients need when they're mobilising, reduce number of adverse events, make them walk faster and walk happier. So this is still about mobilising in intensive care. Number 3, we're going on to cardiac rehabilitation now. So some people have heart surgery, and after surgery, they're encouraged to get up and mobilise by the physiotherapist. You can see a theme. We just like people getting up and doing stuff. The problem is that in some countries, Saudi Arabia being one of them, in order to be referred for cardiac rehab, a doctor has to make the referral. And if the doctors don't know or understand the importance of cardiac rehab, then the referrals don't come through. And so this is a survey-based study to look at barriers and enablers to referring patients to cardiac rehab from the point of view of the medics. Number 4, I can so do this. Cardiac rehab is also very good, but it only works for people who do it and continue it. We have a huge issue with adherence, both in the UK and overseas. And so one student is looking to see whether an app can replace the traditional cardiac rehab rehabilitation. So they're going to use a standard exercise protocol and something called the heart track, which monitors changes in heart rate and blood pressure, to enable patients to undertake cardiac rehab programs wherever they are living. Number 5 this is about diabetes now. The problem with a lot of our research is that our inclusion criteria is for people who have a heart condition but no other comorbidities. That reduces the amount of eligible patients to take part in studies. And so we don't know a lot of the time about how patients with multimorbidities cope with things like cardiac rehab. So this is a specific study looking at patients who have a cardiac condition and also diabetes to see whether there are any differences in baseline data and outcomes depending on how many other conditions the patients have. Moving on to the paediatric intensive care unit. So I'm interested in health through life, but this is going to paediatrics. When physios come and do some physio on babies in intensive care, sometimes parents get a little bit twitchy because it can look a little bit physical. And so this study is looking at parents' perceptions of physiotherapy taking place in the intensive care unit. The aim is that we would try to create some teaching tools for parents who have children in intensive care so that the physiotherapy treatments don't look quite so frightening. We couldn't do some respiratory research without mentioning COVID, and so we've got a lot of data from COVID-19. And so one student wants to look at the impact of frailty on post-COVID recovery. I know somebody else was mentioning obesity as well, and there are so many different factors that could affect post-COVID recovery. And then from the other side, our physiotherapy students had a different experience of education during the COVID years. So we're doing a lot of online teaching and very little face-to-face. And that may be affecting then what sort of physios are graduating going into the workplaces in terms of skills missed. And so this study will interview some newly qualified physiotherapists to see how they perceive their readiness for work as a result of graduating during the pandemic. A slightly different one then is looking at outcome measures by physiotherapists in Bahrain. We like to be able to measure things and see the effectiveness of treatments and then compare the effectiveness between different patients and between different approaches. That's very difficult when people are using different outcome measures or maybe no outcome measures at all. So study number 9 is looking at whether people use outcome measures in Bahrain, and if they do use them, how and which ones do they use. And then we don't want the students to have all the fun. So the last study was by one of our teaching fellows, and she wanted to see whether if you do a treasure hunt for students, whether it will increase their learning of pre-module learning. She set up a treasure hunt around the local area where she asked questions about cardiac conditions to see whether that increased their learning and engagement. Now, if you want to hear some studies in more detail, we have a research symposium here next Thursday. So please come, and then there'll be wine and pizza. And that's me done.